From my perspective, a postgraduate Year 2 infectious disease pharmacy resident is someone who wishes to obtain specialized training in the treatment of infectious diseases. What motivated me to do a PGY2 residency in infectious disease care is that postgraduate training will enhance my marketability in the job market. Also, infectious disease is, in my opinion, one of the most interesting fields of medicine. And also it affords you the ability to work with a patient population which is very diverse and at the same time also very clinically challenging. I earned my PharmD from West Virginia University School of Pharmacy, and I went from there to do my postgraduate Year 1 pharmacy practice residency training at LSU in Shreveport, Louisiana. And that allowed me to come to Jackson Memorial Hospital to complete my PGY2 in infectious disease care. Some of my duties as a PGY2 infectious disease pharmacy resident include rounding with the physicians on the infectious disease medical team. Also, I perform topic discussions with other clinical pharmacists and PGY1 residents and pharmacy students as well. I also have the opportunity to teach those PGY1 residents and pharmacy students through these topic discussions. I'm also responsible for developing projects to enhance patient safety, reducing costs for hospitalizations, and also by optimizing drug therapy by collaborating with physicians. Some of my duties as a PGY2 infectious disease resident include daily rounding with the physicians on the infectious disease care team. Also, I perform topic discussions with other clinical pharmacists, PGY1 residents, and also pharmacy students, and I have the opportunity to teach those PGY1 residents and pharmacy students as well. I'm also responsible for developing projects that will enhance patient safety, reduce costs, and also optimize drug therapy by collaborating with physicians. On a typical day, I'll arrive at the hospital in the morning. We'll have time to work up my patients, and then I will go on rounds from about 9 till noon with the infectious disease team, and I'll give any interventions that I think are necessary. Afterwards, I'll come back down and I'll communicate all of the interventions that the infectious disease team wants to implement with our patients to other clinical pharmacists. In the afternoon, after I communicate all of our interventions, I have time to check up on all the patients once more. I have time to work on any projects that I'm responsible for at the time. Because I have many responsibilities, it's very important that I do stay organized. So to-do lists and calendars are very important to me. My best advice to attain an ID pharmacy residency as a PGY2 is to harbor relationships with the ID faculty at your School of Pharmacy. So going up to that faculty and letting them know that you're interested in infectious diseases, maybe trying to work on any research projects with them. That'll be the best way to get further in the field of ID pharmacy.